Hi, everybody. Welcome back to the Tummy Team podcast or the Tummy Team Journey podcast. This is Kelly Dean. I am your host and physical therapist with the Tummy Team. And I am back again with Christina Trautman. And we promised you this podcast and we got sidetracked last time. But this podcast is going to be talking about the importance of prenatal core and pelvic floor care and treatment, and not necessarily waiting until after the baby comes. And it's just, I think it's becoming more and more common to get this care, but I still think it's really, really neglected. And I would love to just shed some light on that and talk about it from both of our perspectives. And we'll talk about, our pregnant clients, and we'll talk about why um, preparing instead of just repairing can be so valuable. So thanks for joining me again. Thanks for coming back. How are you doing?
Yeah, absolutely.
All right. So let's just start out with so if you for those of you guys that don't know, Christina is also a PT and she owns I have the tummy team. She has the pelvic floor place. But we both address kind of both things, just we start in different areas. Our focus is just slightly different, but we're seeing a lot of the same conditions. And she has her own clinic here in the kind of Vancouver, Washington area, but also sees some patients online as well. And she's worked with me. She also goes. We go and teach classes together. We have lots of fun together. So let's talk about the types of clients, the types of prenatal clients that you tend to see. And then also let's maybe talk about the prenatal clients that you wished would come and see you. Not that you don't want to see the ones that see you. You know what I mean? You know what I'm
Yeah.
saying?
Yeah.
Okay.
Yeah. So I would say, pregnancy patients now have become probably about 60% of my caseload that obviously turned into postpartum as well. That was not the case when I first started 15 years ago. So
Are these prenatal that had seen you previously postpartum, or are they brand new prenatal clients?
some, but I would say a fair amount are brand new.
Oh, cool.
Um, and that I think has to do with, I'm in a practice with midwives. And so they, it's a pretty easy referral system that way. I'm also, working with a prenatal massage therapist and Pilates instructor. And so I'm in a very prenatal
Yeah.
space. And so I think that does help. But also I think just like the community, I feel like majority of my referrals are word of mouth, right? Of friends and sisters and moms and that kind of thing. And so, yeah, I definitely feel like majority of my prenatal clients probably are on their second or third pregnancy. Um, didn't do it on their first pregnancy, didn't think they needed to or didn't know about it, had a hospital birth, something happened at some point where they had some type of pelvic floor core symptom postpartum. Maybe I saw them during postpartum and recommended they come back during pregnancy. So that is a pretty common thing. And then they'll come back during pregnancy. And yeah, so I feel like
What are the symptoms that they're coming in during pregnancy? Are these patients coming in um, being proactive exclusively, or are they already having core pelvic floor symptoms that are bringing them in?
I would say about 5% are coming in proactively. My prehab patients, I call them.
Yes.
And they are like word of mouth friends of like, hey, I know you don't have anything yet going on, but go do this now so that you don't have to deal with the stuff that I went through, years later or whatever. It's not their OBs or midwives or anyone telling them that they should go in, right? That's not really part of the care. It could be their own research or their own social media or whatnot. But yeah, majority of patients coming in have a symptom of some sort. So, we're talking about, I'm noticing coning down my abdomen and this little alien popping out of my belly when I go to sit up. Is that normal? Or I'm feeling some weakness there. Low back pain obviously is super common. Sciatica, really common. Pubic symphysis pain, of where that pubic symphysis starts to separate. leaking, prolapse sensations, pelvic pain, pain with sex, hip pain. I've been seeing that a lot more. I do see a fair amount of athletes. And so I think pregnancy obviously is just one extra challenge to an athletic mom. And so, I feel like I do end up seeing a little bit more in that arena. So those I would say are kind of the main symptoms that I'm seeing. But yeah, about 5% are, hey, my friend told me I should come in. So here I am. Like, I'm pregnant. I'm 16 weeks. I'm full of joy. I'm excited. I want to feel really good. I want to keep being active during my pregnancy. And I just want to prevent everything I can. And I want to do some birth prep so that I'm just can control all the things that I can control. So obviously I would love to see more first-time moms. I think part of the reason I don't is that some of my referrals, like from the midwives, they're also not seeing first-time moms, right? First-time moms tend to have hospital births. They tend to go to OBs until they maybe realize that they want to do something differently the second go around, or they want a different approach or whatnot. And just the information, right? If they're going to their OB, they're not necessarily getting the education on pelvic floor and core. And I feel like that's where the biggest problem is that education piece, right? And I know that they don't have the time to do that. They carry way too many hats as it is, in terms of their responsibility. So they don't have the time to do that. But it needs to happen somewhere during the pregnancy. And I feel like that's where the biggest issue is. And so if you're not in pain, you already have a million appointments set up for your baby for pregnancy. Why would I go see somebody to maybe and pay extra money and there not really be a lot of issues going on? I can kind of understand to some degree why that could happen. But seeing the other side of it, of like yesterday, I had two moms postpartum, pretty identical, very similar. They're first time moms. They had, I would say, similar age for both of them. They had a similar pregnancy, similar postpartum. But it was so night and day when I asked them how to do a core and pelvic floor contraction, to see the awareness, the connection, the coordination, the strength, everything of the mom that I saw during pregnancy versus the one that I didn't. The one I didn't, it was like I spent a whole hour just trying to do one thing with her, versus the other mom, it was like so much easier. I still get so it still just like shocks me so much at how much that helps postpartum is when we work on that during pregnancy. I feel like that's probably the biggest reason to come in during pregnancy, is just being able to establish, because, the abdominals are stretching, the pelvis is widening. We don't have a new normal. And so if we don't do that core pelvic floor rehab during pregnancy, our body is just kind of like, well, we don't really know what our normal is. And so we really have to establish that, right?
Yeah. Yeah. I would say that I'm maybe, I don't even know. I would say that I am maybe 30% to 40% are people that are first time mamas with me. Um, in my pregnancy pool, right? And then maybe 60 to 70%, it's not their first time. They're coming back. They saw me before, or they had something going on. I love when we can see them ahead of time. The number one thing that every client says to me is, I wish I had done this before I was pregnant.
Yeah.
That's hands down. I wish I had done it before I was pregnant. And so what I tend to see is diastasis, because that's what my specialty is, right? So I see that separated abdominal wall. And it's interesting. You said it, and they're like, "Is this normal?" I always like want to say to them, I was like, "Well, you're here. Did it feel normal?" They're like, "No," but, they've been told it's normal, and they know in their gut it's not normal, or they desperately want you to tell them it's not normal. And so I was like, it's common, but it's preventable, it's changeable, it's treatable even while you're pregnant. And the sooner we can address it, the sooner we can be proactive. We can minimize to almost non-existent a diastasis, or how there may be some stretching this way, but there's not coning this way, and there's not
Yeah.
pressure down, right? We're not having the consequences of the diastasis. I also see a lot of rib pain,
Yeah.
because their chorus, their transverse is not supporting the rib cage, and so they've got a lot of rib pain, back pain, SI, pubic symphysis, sciatica, and some pelvic floor stuff as well, heaviness. But a lot of what I'm seeing is diastasis. And so what I have this really unique situation is I also am an instructor at a midwifery college. So I'm teaching midwifery students what we're looking for. And what I have done in my course is I break it down into, like, they say that the average midwife has like 15 sessions with a therapist or with a client over the course of their time. So I break down like the things that I feel like could be proactive or could be even reactive for clients that may not be able to afford to come in, they may not come in, or like you said, it's one more thing. So I break it down into midwifery. Like they do have a million things going on, but I just give them like one 3-minute thing that they're going to teach at each session. And
That's
so
awesome.
yeah, so it starts out with, we're just going to start with like knowing what your posture looks like and your alignment. And then maybe they do teach them like one, like exhale and engage. But if they don't get it, they don't worry about it. They just have them talking about how can we keep their pelvis and rib cage in alignment? Like where are they sitting at work? How are they sitting in their car? How that posterior pelvic tilt impacts fetal alignment, back pain, and core activation and pelvic floor activation. So like they like have this little blip with like this little handout that they do at the first one, and then at the second one they do a little bit of this. And then like there's some other ones like based on, okay, you have a client that comes in and they're telling you their symptoms and they're saying, I have this low back pain and or I have this rib pain, and I have like a couple of stretches and a couple releases for them to do, followed by some transverse work, and they'll give them just those little things. So I mean, my obviously it doesn't replace somebody being seen by a physical therapist,
Yeah.
but my ultimate goal at the tummy team is to change the standard of care
Yeah.
of diastasis recti specifically, but basically functional core and functional pelvic floor weakness across the continuum. And whether that's it with the midwife or whether it's with like I train people in skilled nursing facilities, like across the board, how are we not dismissing these symptoms or sweeping under the rug, or you can deal with that after you have the baby if there's a problem, those kinds of things. Like how can we be proactive? And so um that's super exciting to me because every semester I have 30 midwives that are going out there and they're going back to their preceptors, going, teaching their preceptors,
Yeah.
because the preceptors may have done this for 30 years, but don't know this stuff, or like you said, they don't know how to fit it in to
Yeah.
the millions of things they're doing in their short session with a client.
And
Doulas have a,
really, like, their sessions aren't about the mom,
mm-mm.
right? Like, you're asking them a little
Obviously,
bit
it's
of how they're
baby.
doing, but it's all
Yeah,
about baby,
it's all
right?
about
And so
baby healthy.
there's not really a way to, like, if I were to, as a provider, then have, ask all these questions about how are you doing? How's your mental health? How's emotion, physical? Like that would take an hour session to do it for the baby and for the mom. So, if you have this like little blip of, yeah, like here's your check-ins of things that you could, ask easily each visit would
Yeah,
be awesome. Yeah.
yeah. That's kind of how I set up the course. The other thing that I love about seeing our clients prenatally is not just that we can help relieve their pain, we can help them feel better, because, ultimately you're going to be the mother. There is no intermission after birth before motherhood.
Yeah.
It's like hit the ground running. Like from day one, try to get that baby to latch, right?
Yeah.
Like it's just nonstop. But I feel like it is important to set the mom up for success
Yeah.
physically so that they can be emotionally present, so that they have the things. But also those first 4 to 6 weeks of motherhood are so hard,
Yeah.
so demanding, and your body is at its weakest. And this is like to say, like, and even sometimes I will hear, well, at 6 weeks, you could go to PT, which I understand they might not actually even be able to think about it before 6 weeks
Yeah.
or internalize anything. So I love to give them an
Yeah.
immediate postpartum plan,
Yeah.
including all of the newborn parenting posture stuff that we talk about, like setting the stage before baby even comes. We always
Yeah.
talk about the baby, moms always are like, let's get the baby's room set up. And I'm like, oh, baby's not even going to be in that room for the first six
Yeah.
months.
Yeah.
Like, time for that, girlfriend. What you
Yeah.
need is to set up your nursing throne. Where are you going to change the baby? Don't think you're going to do it on the bed all the time because your back will kill you. Like
Yeah.
all like, how are you setting up the baby care? Because that's going to consume your life. And how can we set mom up to survive and to be connect to their core and to their pelvic
Yeah.
floor and to understand, like, if they're feeling heaviness, that they need to actually lay flat,
Yeah.
like giving them a toolbox for those first 6 weeks when it is the hardest, and not say,
Yeah.
okay, now just power through that and then you'll get to PT at the end. I feel
Yeah.
like that's a really poor strategy.
Yeah, I agree. In my kind of the way I handle that is I talk about that a little bit in during that birth prep appointment, kind of towards 36 weeks. But there's so much that they're trying to ingest that I have them just email me once baby is here, and I'll try to email them too. And then I have like, okay, these are the things to start doing for the week 1 and 2, week 2 through 4, week 4 through 6. And I actually do have them come in earlier than 6 weeks. I try to get them in like 3 to 4 weeks to
Yeah.
just start doing some posture and connection.
Yeah.
They're still bleeding, they're still not feeling great. They bring baby, sometimes husband comes in. But I really like just at least giving them some of those handouts that they can start doing on their own. And then when they're ready to come back in, then,
Yeah.
we can wait till that kind of 4 to 6 week mark.
Yeah.
But the earlier they start doing some of that connection stuff, that first
Yeah.
like week to 2 weeks, I think is huge. I
Yeah.
see
And that's what
so much more changes postpartum if that starts happening sooner.
yeah. And
Yeah.
I think in their mind, they're like, "I can't exercise, I can't do
Yeah.
anything just 6 weeks." This is an exercise.
Yeah.
This is posture breathing. This is
Connection.
rehab. This is self-care. Like, when we have, like a knee surgery in the hospital, they're doing exercises an
Day one.
hour after the
Yeah.
surgery, right?
Yeah.
And so, like, this is not working out. This is like, you just had a major thing go on and you need some support. I
Yeah.
actually like to, I really like to build everything into people's real life
Yeah.
movement, right? Things they're already doing, what they're doing on the toilet, what they're doing when they're brushing their teeth, what they're doing when they're putting their kids to bed, what they're doing when they're nursing the baby. So I really try to, like, build, like, habit stack and build functional integration into what they're doing. And
Yeah.
so I'm trying to set those habits in place and then them anticipate, if they've had a baby in the past, they kind of have an idea of how much time it takes to be feeding the baby, changing the baby, holding the baby, rocking the baby, all of those things. If they don't, I kind of give them, maybe not worst case scenario, but a real reality of, like, this is how much time this little newborn's going to require of you, and how can we what can we look at and what that looks like. And even just setting, like, having them be proactively, where do you think you're going to be nursing most of the time? you
Yeah.
know it's 9 out of 10 times it is not in the nursery, so don't set
Yeah.
that up there. It's in the living room or in your bedroom. And
Yeah.
so put your stuff where you're going to be ahead of time. And so you're not like, have this great place to sit in the nursery, but you're sitting in this terrible place on your couch.
Yeah. For
Um,
sure.
yeah. So I like that. The other thing that I think is also interesting that I found kind of by accident, is that sometimes, like, I'll have clients that come in with or that see me even online with, kind of, things that I'm not sure PT can help with, like irritable, um, uterus, where they're having lots and lots of contractions,
Yeah.
and, and then we will do some work, we'll work on the alignment, and we'll work on the breathing, and then that really subsides.
Yeah.
Um, it's just fun for
Neat.
me, like, you can kind of go, retrospectively, you can kind of go, "Now I see why that would happen, but I
Yeah.
didn't put it together." Are there things that you see, symptoms that you've seen, this is kind of putting you on the spot, that are like, "Okay, let's see if we can improve that," by just putting them in a better helping their body work better for themselves?
Yeah, I would definitely say there's some medical things that I have seen in the past. A lot of it has been like connected with like hypermobility syndrome and like EDS. Like a kind of more hypermobile bladder neck where they have more urgency and more issues that way. So there's a structural defect of some sort. And so will strengthening or, alignment, posture, that kind of stuff actually help this medical condition? And oh yeah, like I would say at least if, I mean, I've never seen it not help even
Improve.
a little bit. It's
Yeah,
going to improve to some degree.
right.
Just putting you in a better position, less repetition, and just better, like you said, habits, right? Of just kind of developing this kind of different quality of life. So I've definitely seen it from a bladder standpoint. Um, I had a crazy one happen that yeah, it kind of caught me off guard of working on someone's ribs, and I was doing some manual work on a rib, and a patient had gestational diabetes, but she had not told me that. And I was doing some rib work, and she had to take insulin for her gestational, and she was like being highly monitored, how they usually are. And I did more manual work than I probably normally would, but it just kind of felt like she needed it. And she left and came back the next session, and she was like kind of sternly goes, "What did you do last time on me?" And I was like scared of like, oh shoot, let me look at my notes real quick. Um, and she's like, "I don't have to take insulin anymore." And she's like, "I'm actually not even like, my levels are not even gestational diabetes," which is kind of
Low.
crazy.
Yeah,
Right?
yeah.
But, like, at the same time, like, yeah, there's a lot of different things that can happen, but she's like, "Almost immediately after seeing you, I just felt a little bit different." And so I was looking back at my notes, and I was doing a lot of fascial restrictions around her pancreas and doing some, like, visceral stuff and some stuff with the rib cage, and, um the doctor even called me because he was like, what were you doing? Because this woman no longer has gestational diabetes.
Right.
You worked on this medical condition." I'm like, "Oh, I didn't mean to, but I'm really happy that she's feeling better now." So there's that. So that was kind
Yeah,
of the most I feel like
yeah,
probably that's ever happened to me. But yeah, it's pretty wild how some of these medical conditions can
yeah.
really improve with just some, yeah, a little bit of manual work or some strengthening and changing kind of some of these postures and things that they're doing over and over and over again, you know?
Yeah, and I think we can, forget that the muscles we get so focused on, how the muscles look and stuff like that, and, like, them doing these big jobs, like, not letting us wet our pants and stuff, but they're doing a lot of big jobs. Like,
Yeah,
the muscles around your core and your pelvic floor, it's the canister of all your organs.
yeah,
And, even your spine, like having your spine supported in a better position, the spine, is the support of all your nervous system, right? So, like, there and then to think about, like, if you are in restricted, like, muscles are really tight holding, there's restricted blood flow, and blood flow also changes how our body functions.
yeah,
So I just feel like in every case that we see, pregnant or not, like, our body has an optimal position where it's going to thrive, and I think
yeah,
anybody listening knows that. They know when they're sitting better and when they're not, and how their body
Yeah.
feels if they eat something good and they don't. Like we all kind of know underlying that there is. It might be elusive what that is, but you think about pregnancy and we are growing another human being pretty rapidly. And there's a lot going on in that time, and there has to be space made for that. And our body has to have enough blood flow and enough, nutrients and enough, like, there's a lot of things that have to happen. So, real and yes, it's a part of nature, it's a part of humanity, it's a part of what happens, but why wouldn't we want to be supporting that
Yeah.
better? Not
Yeah.
necessarily saying, "Oh, you need to sit down and do nothing." That's not really, we would never train for a marathon by sitting on the couch and doing
Yeah.
nothing, right? We have to actually think about this is like the birth is like an athletic event.
Yeah.
The muscles are doing a lot, but even the pregnancy is like there's a training involved of these muscles stretching and the contractions that are happening and the support system that's happening and everything trying to hold the body together when everything else is trying to push the body apart. It's
Yeah.
like this tug of war thing that's happening. And then, that happens. Then we go through this major birth trying to push something big through something small. And and then all of the hormone changes and stuff. And now we have a baby that we're taking care of, like a little thing that is completely helpless. And
Yeah.
so it's just like if we take a moment to look at how uh dramatic, it is, it's a
Yeah.
no-brainer that we would support it. But I think that we are just a negative feedback system and
Sure.
we address things when they're wrong, right? More
Yeah.
than when they might go wrong. And I don't want to set the stage for people like, oh, you only need to do this so that something bad doesn't happen. It's not a fear thing. It's a just like being proactive. And I feel like
Yeah.
if you were going in for like a total knee replacement, you do exercises beforehand to build
Yeah.
up and to be prepared for it, right?
Yeah.
Um, so
Yeah.
yeah.
Absolutely. Yeah, I do. I agree with that. I do feel like, and I think a lot of that though is our insurance-based system too, right? Like, do they pay for preventative? No, right? And so, I think there's some pieces in that too that we're setting people up only for being sick or being
Yeah.
hurt, then going in to get treatment. That's when the insurance will cover it. And so I think it's just a poorly really built system that hopefully we're changing a little bit in some degrees or another.
Yeah,
But
I'm starting to see some things changing um slowly, right? And
yeah,
you don't get reimbursed enough. And I also feel like the next generation of moms are far more educated, and
yeah,
dads for that matter. Like, I have
yeah,
so many involved dads that are doing the research and wanting to support
yeah,
the mom, and so many partners that are just in it, and I love that. I feel like there is in some ways, there is a change, and I don't know, some of that might be social media or just like our AI culture of everything, let's just look up the solution.
yeah,
Um, you know, um, I think that some people have friends that have had bad situations and they don't want that to happen to them. But
yeah,
I'm hoping more often than not, they're going in to parenting, with their eyes open a little bit and
yeah,
wanting to get wanting to have the best experience.
yeah,
Um, let's talk a little bit about those return clients, those moms that maybe this is, they didn't come see you till after things were really poor, they had lots of babies. I've had several clients that saw me at their 5th or 6th baby and then were like, absolutely shocked that it was, like, the best pregnancy of
yeah,
all of them. I have this really great fetal alignment picture that I share usually, multiple times a year, but it's of a mama that is on her 4th pregnancy, and showing, like, the change in, like, her belly alignment from her 4th pregnancy at the same place as, like, her 3rd or 2nd pregnancy,
yeah,
and, like, that it's not too late.
Yeah,
Yeah.
and I think, yeah, there is this like, well, I'll just wait till I stop having kids because I'm just gonna stretch out again, or I'm just gonna have a diastasis again. So why do I even work on it? Like that's just like I think a really poor way of looking at life, and the more, and we have to remember that like these muscles have elasticity and collagen and connective tissue, and we need that connective tissue to be dense. Right. And as it stretches, it's like that rubber band. We need to make sure that there's that tone and those muscles are activating to keep that density of that connective tissue. That's what's going to help, postpartum. And so the more that we can do that, the better. But yeah, I have so many moms. I see a lot of pregnant moms who have a lot of kids in the area that we live. There, that's a big priority to a lot of these moms, is having a big family. And seeing these moms, yeah, I have one in particular in my head. She was just baffled at how great she felt with doing some core and pelvic floor work with her first pregnancy. She's like, Christina, I don't even think I felt this good with my first pregnancy, and then she had a fantastic birth and fantastic postpartum, and she just felt like more set up. I mean, obviously she has more education at that point too. She's older. She has maybe an older kid that can help take care of some of the younger ones. So there's other pieces that play into it, but it's really fun to see that, but it's also that I'm like, I was here. I wanted to help you during your first, second, third pregnancies.
Right.
And it sucks that it took you to go through all this pain and like suffering to finally get help. But yeah, it's
Yeah.
just kind of the system that we're set up in. But yeah, it's fun to see those experiences happen of like, this stuff really works.
Yeah. And I think also just that shifting that the idea of it doesn't matter how bad your symptoms are. I think there's also where clients get to the point where they're like, this is too much to repair.
Yeah.
And what I want to say to those clients is part of that feeling of like that apathetic like feeling is because your body is not holding you together. Like,
Yeah.
we can't even begin to think about doing anything when we're so empty, and having that, like, super pendulous belly and that very weak pelvic floor, the energy just to get through the day is overwhelming. So to think, "Oh, and now I'm gonna have to do exercises, or now I'm gonna have to, go to another appointment," like, it
Yeah.
just feel like too much. But what I really wanna encourage, those particular people is that's exactly why you need to come.
Yeah.
That's exactly why you need to come, because we can help you make feel better.
Yeah.
Like, there are some things that we can do that are small things that will help you feel just enough better that you'll wanna do a little bit more, which will make you just a little bit better. And, yeah, and even if I could only see a patient one time before their delivery, I would rather do that. Like,
Yeah.
even if I only have one time, like I have this on our online membership, I have the prenatal crash course, and it's actually like we put it in our $15 a month membership. So $15 a month, they can get the crash course, which is basically if I had one time to see somebody before they delivered, what would we do? What would I say? And a lot of it is giving them that initial postpartum plan, but
Yeah.
some of it is just getting them prepared, and giving them anything. Something is better than nothing. And like you
Yeah.
said, they might not, all of the clients might not be all the way better, but they're better. And
Yeah.
better is worth it,
Yeah. And,
Yeah.
those other tools like splinting, like doing these other things that can give them some proprioception, that can give them a little bit of support where they're not having, we're not like a typical physical therapist where we're giving you 8 exercises and you have to come in twice a week. We're not, we're going to be looking at like functionally, where can we help support you at home? We don't want to make you even more overwhelmed, right? We're trying
Oh,
to help make your life easier. Like my goal is to give you the minimum amount of things where I still can see progress, right? And I think
100%.
that's where using the splint, using some things that can give you some of that support and that feedback,
Yeah.
without making you feel like, oh, I have to go through this thing that's going to create even more energy, and I'm going to have, it's going to be one more thing that I have to do in my day.
Yes.
I feel like most people leave our sessions feeling like, oh, that was inspiring. That made me feel so much better. And I can do this. This is
Yeah.
manageable. Yeah.
Yeah. Yeah. Yeah, I agree. I think that that's how we treat people. We're listening first, getting a really good understanding of what's going on, what their life looks like, and how can we support them and help them get feel a little bit better. So and really building it into their everyday lives. I think that splinting, has so many uh different, using an abdominal rehab splint in pregnancy and postpartum. There's a lot of information out there. And I do feel like it can be super helpful during pregnancy. And
Yeah.
it's not like you put a splint on all day, every day, but
Yeah.
I find it so much, although, although if I have a client that's, 4 weeks out from their delivery and it cannot make it through the day, I'm gonna splint them as much as they need,
Yeah.
to give them, but I'm gonna give them some other things, but the splint to help them get to the finish line and function and get connected and have the support they need and decrease their pain, so they're not super exhausted going into the birth. I feel like sometimes that's a valid treatment plan.
Yeah.
Um, and so, but there's also just intermittent use of the splint for feedback when they're tired or when they, some of my irritable bowel, or and I want to keep saying irritable bowel, but my irritable uterus patients, the splint is really, really
Yeah.
helpful,
Give them a little
which
extra support.
it tells us something, right? If them having the belly up and supported calms down those overactive contractions, that tells us like the alignment is part of what's triggering your body to do those
Yeah.
contractions,
Yeah.
right?
Absolutely.
Yeah. When do
Yeah.
you use the split? What types of clients? How often do you use them prenatally? Do you use them with all your clients prenatally or with
I
some of them
think,
based on
a
the
lot of
situation?
my repeat clients, I'm not using it as much because they've been doing like core work postpartum and during pregnancy, and I don't feel like they really need it as much and they have more awareness.
Yeah.
But a lot of those, yeah, first time clients, whether it's their first baby or not, will use it. Um, I tend, you know, just because they have a diastasis, I won't always splint. But if they have a diastasis, they have low back pain and they have SI instability or pubic
Yeah.
symphysis, I for sure will probably either bring that in or an SI belt of some sort to give them some more support. So it's definitely not every patient, but I have them here and it's a tool that I use quite a bit. Yeah.
Yeah. Yeah. I would say that maybe 60% of my prenatal clients will splint somewhat during their pregnancy, but I introduce it to most of them near the end so that they will have an awareness of it for postpartum because I do
Yeah.
feel like immediately postpartum, um, I don't know if I want to go as far as say that it should be standard of care, but I think it should be more than it is now. I think
Oh,
it should
yeah.
be offered to every client for those first few weeks at least. It's like thinking about how much physically is required of the mom when her stomach just went from this to like this deflated balloon. The connection, like I've seen such a huge connection between splinting and postpartum anxiety, postpartum depression, just because
Yeah.
it helps mom feel calmer. There's that deep pressure component of it that calms our nervous system and helps us to not spiral. And I know that there's a lot of factors involved in those conditions, so it's not the only solution, but I totally see it, and we also see that when mom is calm and connected, baby is often more calm
Yeah.
and not as agitated.
Yeah.
So I feel like I do introduce it to all of my clients going into that postpartum stage. I encourage them all to have it in their bag. There are times for delivery that I feel like the splint could be helpful in the
Yeah.
delivery process. Because if you're very fatigued or if baby's in a odd position, it can help put baby in a really good
Yeah.
position and take some pressure off mama.
Yeah.
So,
I
yeah.
agree. Yeah, it's a great tool. It just gives that proprioception, which I think just helps so much. So even if they can't feel like they can't do a lot of exercise or even do one exercise, we at least have something to give them to help. Yeah.
Yeah, and then they can feel it. Like anybody that puts a splint on, immediately you see it in their eyes. They're like, "Oh,
This feels
that's what my
good.
belly's supposed to be doing."
Yeah. Like that,
I
like
remember
sigh of
way back
relief
then.
of like, oh, I feel like I'm getting a hug, that just feels
Yes,
supported.
it feels supported.
Yeah.
I know you do prenatal training as well. Can you talk a little bit about? Do you talk about birth training? Like, do you talk? What do you do with your clients in terms of like preparing for the actual event of the birth?
So depending on when they come in during pregnancy, I usually ask if they want that. I don't think anyone's ever said no, they
Oh,
don't.
I'm
But
gonna wing it.
um, if they're coming in around 20 weeks or so, I try to kind of bring that in within like 3 sessions. So it's a form of kind of birth prep where I'll start with kind of talking about like if it's their first time, these are kind of some of the reasons why there might be complications during birth, and so some things that maybe we could start to train for. So kind of the why behind some of my exercises and why behind some of the things that we're doing. But for sure, I have them come in at 36 weeks or 35 weeks with their partner. And we go over different birthing positions, and I'll actually check their pelvic floor vaginally if they want that. When just find the position where their pelvic floor is the most relaxed. And then I'll actually have them go through their breathing for like labor, for like if they were to have a contraction, what would their breathing look like? And then during pushing phase, how would that change, and making sure that they're bearing down appropriately for pushing. And then, yeah, I'll go over different, like if they're not having a doula, I'll go over different placements that their partner can put pressure on the pelvis to kind of help open up either the inlet or outlet, depending on labor or birth. But I really make sure that they know how to dissociate the core from the pelvic floor. So I go a lot over like how to do that during bowel movements during their pregnancy. And then we kind of bring that into that same kind of birthing stage, because that's one of the main things that they're not being taught. Like no
Yeah,
matter who they're seeing, unless they're seeing a PT, and even if some PTs don't really talk about this, making sure they know how to engage their core but keep pelvic floor relaxed. I think
yeah,
that's one of the main reasons for not progressing during labor, honestly, is that pelvic floor doesn't know what to do, and there's no connection with your breath and with your core. So that's a
yeah.
big
And
piece that
when
I
you're in
bring in.
pain, you tense up and shut down and clench and
Yeah,
close, and how to be able to um, sup engage what needs to be engaged and relax what needs to be relaxed, and
yeah,
practicing that when you're not in pain
yeah,
is always good, or
yeah,
when in the intensity of the moment.
yeah,
Yeah, yeah. I love that. I love that, I teach the positions as well, but I love that you are what you're adding to the positions by checking them in those is the individuality of that person,
yeah,
right? Of that person's body. I try to talk my clients, and when I teach the midwives as well, talk about the different positions. And with the midwives, it's so eye-opening to them why we would change positions. Like they know from their standpoint, but when
yeah,
I show them from a biomechanical standpoint or like a physical, tightness or really, or what their symptoms are showing them, why we might want to be in a or the position of the baby, if the baby's asynclitic, how being sidelined in a certain way can actually just use gravity, and the uterus contracts asymmetrically when you're on your side, so how it can
yeah,
straighten the baby out. How back labor, why that hands and knee position can help shift the baby's position.
Yeah.
So like helping from the midwife's standpoint, like I want my patient to be and my client to be informed, but in that moment, and that's why it's nice to have their partner in there
Yeah.
because they're not going to remember.
No.
They're not going to remember their options.
Yeah.
Um, I have them practice the disassociation in each one of those positions because they're not sure which position they're supposed to be. They're going to need to be in. But I love teaching it from the midwife standpoint because they know now why. Let's try this
Yeah.
position. Why?
Yeah.
From where I'm feeling the position of the baby or what their symptoms are, how this change in this position could really help free up. I love that you're looking at that uniquely for each patient because some of us have a leg length discrepancy. Some of
Yeah.
us, our uterus is naturally tilted this way. Some of us, have like a really tight, psoas muscle on the left,
Yeah.
So
And
there's
it does
just
surprise me. Like, for the most part, hands and knees with, hips and internal rotation is kind of the fave position. But like, yeah, I did birth prep yesterday with a client and side lying. She had so much power in side lying and she felt so fatigued on all fours and she didn't like recline sitting. She didn't like standing. She really liked side lying because it was familiar to her. And she had a ton of power there, which kind of caught me by surprise. So like, yeah, it's neat to be able to look at these things prior to so that it's not so chaotic the day of and they're not trying all these things and them not working. Like she already knows what works, and even if she does still try some other positions, she
yeah,
still kind
it's
of knows in the
empowering.
back of her brain what's going to be beneficial. And I think too, from a hospital standpoint, you kind of have to advocate for yourself if you don't want recline sitting
Mhm.
or feet in your stirrups. So if you want all fours, you got to push for that. And I think just empowering them that they get that choice and they get to labor in whatever position they want, as long as, baby's okay.
Yeah.
And making sure that they feel confident in that. And I usually, push it onto their partners of, make sure you, help.
Yeah, this is your job. You wanted
Yeah.
something to do. This is
Yeah.
it.
This is
Yeah.
it. Yeah. You got to be the like strong kind of
Yeah,
annoying patient.
and having notes with you, like I give them handouts of like different positions and why and stuff like that, but I think coming with notes because you might forget, um, and just being empowered and advocating. I think, this is a major, like I said before, it's a major athletic event, and, you would train for it just like anything else. You would
Yeah.
train for the beginning, you train for the middle, you train for the finish, and you train for recovery. And when
Yeah.
you don't, like we've all done something what we didn't train for, and it didn't go well in one of those stages, right?
Yeah.
It
Totally.
may have gone well, but the recovery was terrible, right?
Yeah.
That's the big thing that I want, people to understand about prenatal work, is that it is about empowering you to we can't control every outcome. Like,
Yeah.
you might go through all of this and still end up with a baby that's coming out face first and a C-section, like our colleague,
Yeah.
who did all the right stuff, was really, very much advocated, really did all of the core and pelvic floor work, and her baby came out face first, stuck in the birth canal for a really long time, and ended up with a C-section. And but she had a really good birth recovery. In the past, she had a baby that was vaginally delivered, but was like on a walker for 6 months afterwards, right? And so even though her actual birth changed without, out of her control, all the work she did still helped her
Yeah.
be very empowered as a mom because now that baby came out kind of all bruised and had some feeding issues because had a little bit of a traumatic birth, but she
Yeah.
was totally connected and ready even though it didn't go the way she wanted it.
Yeah.
So we're not here saying like you do these things and nothing's going to go different than you've planned, but still being prepared is going to help you for anything that happens.
Yeah, 100%. I like that, at some point, whatever training you're doing is going to help that thing, regardless of, I think we just try to control as much as we can. And there's so much more we can control that we're not. And I think
Yes.
that's the part that we are trying to basically come across of there's more that we can do,
Yeah.
to help you through this phase of your life.
Yeah.
It's a long
For sure.
time. 9 months is a long time.
Yeah. And then, we're all right on the other side of Mother's Day. And, I say this all the time. Once a mom, you're always a mom forever and
Yeah.
ever for the rest of your life, you know? And so it's like you turn a page and it's never going back.
Yeah.
Um, and so it's like really trying to set yourself up you know, the best success you can have in that situation. So
Yeah.
yeah.
Absolutely.
Yeah. Anything else you want to share before we wrap up?
Mm, I don't think so. I feel like we kind of went through all my little notes
Oh,
here.
yeah, all the things that I'm sure we could talk about other things, but I
Yeah.
feel I feel pretty good. I feel the one last thing I wanted to say is um when I first started kind of shifting to include more pelvic floor work with the core work that I do, even though I don't do internal pelvic floor work. The pelvic floor therapist that was in my clinic, the person she was trained by, was like, I don't, what was the word? I don't disrupt the womb. So they did not, I think there are some pelvic floor therapists that do not do internal pelvic floor work during pregnancy. Um, but I know that that has shifted. And I want to let's just talk just briefly about the safety of doing that, the
Yeah.
benefits of doing it, and there are plenty of things to do if you don't wanna do internal pelvic floor work,
Yeah.
but you want pelvic floor care. But we just touch on that a little bit. Are you
Yeah.
familiar with that kind of mindset
Yeah.
of like yeah, okay.
Yeah. So, I with a pregnant patient, I usually want to do one internal exam if there's pelvic floor things going on, like prolapse or an imbalance, so we can help them obviously throughout their pregnancy and give them the appropriate exercises. But I also like if there is a prolapse, what positions would I want to maybe set you up in so that we don't make that worse or your breathing or things like that. So I do feel like it's an effective tool, but that can be a super superficial kind of quick assessment. Like I don't need to go very deep and, doing a lot of manual therapy to do that. But I do like to get either the midwife or the OB consent after 28 weeks to do internal work. So if someone has a lot of pelvic pain and they have a very small vaginal opening, sometimes I'll do pelvic floor manual therapy internally throughout their pregnancy and help train basically that vaginal opening perineum to lengthen. And so sometimes internal work can be very helpful for that, but I usually get and make sure I get consent after that 28-week period. And then during that birth prep appointment, if they don't want any of that vaginal work, that is totally fine. A lot of the times, I'm telling them kind of what they're feeling and looking for so that I don't need to do an internal assessment. And absolutely, if someone is not comfortable with doing internal, it's definitely not something we have to do. It just gives us a little more information. But it's not something that I'm doing probably more than like once or twice usually during the pregnancy. So unless there's pelvic pain or something else going on where they really need more of that internal work. But yeah, it's definitely not necessary. And I do try to get like consent once we get past a certain place. But once I hit like 35, 36 weeks, I feel pretty good. Usually if I am doing vaginal work that we're okay, so actually later on is at the very end is probably the safest in terms of doing internal work and that kind of thing.
Yeah.
Yeah.
Good. I think that's really helpful for people to know. And if you're not local, you're not seeing Christina, you're not seeing me, you're looking for a PT local, have those conversations to see what their training is, what their protocols are, what their approach is, and why. You always advocate for yourself, but there are different therapists that have like slightly different approaches than we have, and it's just good to understand the why behind some of that.
Yeah.
So that's really good. Well, I thank you guys. Thank you, Christina, for joining
Yeah,
me.
absolutely.
Thank you guys for listening. And, whether you are expecting, going to be expecting, you've had a baby in the past, or somebody that might be getting pregnant, I feel like this is really good information for you to understand how it's all connected and how we don't need to wait, how it's really important to get this proactive, intentional care as soon as possible, specifically if you're having any symptoms, but even more so if you're not, right?
Yeah,
So
absolutely.
we want to support you to have the best birth possible and the best, be prepared as a parent to do the next thing, which is hard.
Yeah.
Yeah.
Uh,
Yeah. All right. Thank you, everybody. And we'll put some links to Christina and some of the resources that we shared today in our show notes. So take a look at those if you want to get more information about what Christina does. She has some online programs, as well as you can see her in person in her clinic. And then obviously there's all the online resources we have at thetummyteam.com as well. All right. And I'll see you guys next time. Bye-bye. Once again, thank you for joining us at the Tummy Team Journey. We would love to help you restore your core and be strong for the life you were meant to live. You can get more practical strategies at thetummyteam.com, and we'll see you next time.